CPR, cardiopulmonary resuscitation, can break ribs on a person, especially fragile people. Dying patients may wake up briefly in pain and still die because the underlying disease hasn't changed. That's why a DNR is not about giving up. It's about preventing unnecessary suffering at the end of life and protecting the dignity of the dying person. In countries like India and UK, DNR is also known as DNAR, do not attempt resuscitation. Hi, my name is Rupal. I'm a registered nurse specializing in hospice and palliative care. Today we are talking about DNR, do not resuscitate. It's a tough topic, but one every patient and family navigating end-of-life care needs to understand. Now, what it means, what it doesn't mean, and why it matters when someone you love is on hospice. So before we talk about DNR, let's make sure we understand what hospice care is, because the two of them go together. Hospice care is for someone with a life expectancy of 6 months or less, as determined by their treating physician. It's for when no curative treatments are left and the decision has been made to let the nature take its course. A DNR, do not resuscitate, is a medical order that tells healthcare providers not to perform CPR if a person's heart stops beating or they stop breathing. This is often asked to be signed at the time of signing hospice paperwork or before. Because having hospice and not signing a DNR defeats the purpose of hospice, comfort care, and quality end-of-life care. What does CPR actually involve? Chest compressions, which can break a rib or two in the process. Electric shocks to the heart, defibrillation. Emergency medications are given sometimes. A DNR only applies if the heart or breathing stops and the person is non-responsive. A DNR does not mean hospice or comfort care stops, or the patient will be abandoned, or the comfort medications are not given, including oxygen, which people think it would be withheld. A person with a DNR can still receive treatments for infection, oxygen, pain management, palliative care, hospice care, hospital care for palliative management, emotional and spiritual support. Let me give you an example. Patient A has terminal illness. They have been in treatment for years, but now their doctor is saying no further aggressive or curative treatment is working. It's time to talk about comfort care, which is hospice. Now, when the patient or family chooses comfort care, they're also asked to sign a DNR. And that choice means we are not putting the patient through pain and discomfort with unnecessary treatments that will give them a painful death, reversing all that's been done or will be done to bring them comfort. Performing CPR and trying to bring a dying patient back to life only for them to die again, perhaps painfully, that's wrong. The underlying disease is not reversing. If anything, they may wake up for a few minutes and suffer excruciating pain from broken ribs caused by that CPR. That defeats the whole purpose of being on hospice and the idea of dying with comfort and dignity. Now, it is easy for a patient to make this decision for themselves, but I have seen this be a very difficult decision for a loved one, especially when the patient can no longer make that call on their own. If you are the chosen HCPOA, which is Healthcare Power of Attorney, to make that choice and in charge of making that decision, it's not easy. But you're doing the right thing for the patient when they cannot make that call for themselves. you're doing it right. You do not have to prove this to anyone. Just think of the patient and ask, what would they have wanted? That's it. That's the answer. You are an advocate for that patient. If this helped you understand what DNR really means, share it with a family member, a caregiver, or anyone who might be facing this decision. And if you haven't subscribed it yet, please do. I post every week, so you always have a nurse in your corner when you need one. I'm Rupal, and I'll see you next week.